I'm sure in the world as a whole. Minister.
Thank you very much. Good afternoon, countrymen and women, and good afternoon, our friends from the press. I do recognize colleague ministers from Home Affairs, Information and Broadcasting, and Religious Affairs, and I also recognize our cooperating partners from the UN family, World Health Organization, UNICEF, and from Sweden, USID. I do recognize DFID, and I recognize all the cooperating partners that are here. I can see, yes, DFID, are present in the room. Distinguished ladies and gentlemen, today we gathered to get an update on the COVID-19 outbreak in Zambia and globally. I'll preface my presentation by emphasizing that the President of the Republic of Zambia, His Excellency Dr. Edgar Chagolungu, is gravely concerned with this grave threat of the COVID-19 outbreak and has directed a multi-sectoral robust response to this threat. To this effect, he is monitoring the evolving epidemic and is executing a scalable response plan. And today, as we speak, we will give you the interventions that are measurable, or that are commensurate, rather, to the state of the epidemic. Zambia has recorded another case of COVID-19, and that brings the total number of cases to 3. This case involves a Lusaka-based 59-year-old man who recently traveled to Pakistan on 9th March and returned to Lusaka on 18th March 2020. He is currently stable, admitted to our isolation facility, and his contacts are being traced. The 2 cases that we admitted earlier and that we confirmed laboratory positive are recuperating well, and today we're repeating our tests to ascertain progress. Distinguished ladies and gentlemen, we want to emphasize that the measures that we've put in place continue to hold. We continue to restrict public gatherings. We continue to emphasize the need to wash hands and ensure we operate in clean environments. We continue to emphasize the need to be alert and report any suspects to relevant authorities. And we continue to emphasize the need to restrict non-essential travel. For those of you who are working in various public places, who are doing trade in various public places, we reiterate the need for you to ensure facilities for hand washing are available. Remember, hand washing, hygiene are fundamentals in our response. We have raised the level of alertness at all our ports of entry, and our port health staff are working diligently to screen any travelers coming into the country, taking their travel history, examining them for prodromal symptoms such as fever or raised temperature, or indeed any other symptoms. And for those that are suspects, we are admitting them to isolation facilities. For those who have history of travel to COVID-19 high-risk jurisdictions, we are imposing self-quarantine if they do not have symptoms. I must use this platform to emphasize the need for all returning passengers, for all returning citizens, or all returning foreigners resident in Zambia to cooperate with our authorities to ensure that you obey the quarantine rules. We have noted with concern that some of our returning passengers are resisting quarantine rules. The quarantine rules are backed at law, and there is a statutory instrument that has been signed. Statutory instrument number 22 brings into effect reinforced public health measures to protect you, the returning passenger, and the rest of the public from the threat of COVID-19. You are therefore duty bound to obey the quarantine rules. Those of you who are coming from COVID high-risk countries and are not obeying quarantine rules, 14-day quarantine rules, you're breaking the law, and the law will visit you. We have adequate manpower that are doing follow-up and will act in the interest of the vast majority of citizens to ensure that we protect them from contracting the disease. We therefore make an appeal to all of you to act in solidarity of your neighbors and the rest of the public and the bigger Zambian population to ensure that we live within the confines of the law and ensure that the quarantine rules are obeyed to the letter. As I conclude, I'd like to emphasize that this epidemic has continued to show rapid geographical spread globally, and as we stand today, we have 308,463 cases globally, including 13,069 deaths. In Africa, 41 countries have been affected, including Zambia, and in Africa we've recorded a total of 1,248 cases with 37 deaths. The countries that are reporting the highest number of cases include Egypt, that has recorded 294 cases, South Africa following closely with 240 cases, Algeria with 139 cases with 15 deaths, Egypt has 10 deaths, Morocco 96 with 3 deaths, Burkina Faso 64 with 3 deaths, Tunisia 60 with 1 death, Senegal 56, Cameroon 40, and closer to home, the Democratic Republic of Congo has 23 with 1 death. Tanzania has 6 cases, Namibia 3, Angola 2, Zimbabwe 3, and the Kingdom of Eswatini 4. His Excellency the President of the Republic of Zambia continues to work to monitor the epidemic, the pandemic, and will continue to issue guidance commensurate to the state of the epidemic, and will continue updating the nation on any further measures that would be recruited. Community response is paramount. I want to thank the religious leaders for working with government well and ensuring that the measures that have been announced are complied with. We want to thank the many members of the public that have called our call centers and reported suspects, and through them we've been able to follow up these suspects. And some that are in admission today have been out of these alerts. We want to thank all the multi-sectoral team members that have been working at ports of entry and at various areas of the continuum of care in ensuring that this response is enhanced. Our patients that are being looked at after at Lady Manawasa Medical University Isolation Wing are responding very well, and we want to thank the workers that are working there to ensure that our patients remain well. Thank you.
Thank you very much, Minister. That was the latest update on COVID-19. Zambia now has 3 cases, and since last Friday, government's response, the multi-sectoral response, has been escalated to the Council of Ministers, chaired by her Honor, the Vice President. You recall she was briefed last Friday by the Minister of Health at the Council of Ministers meeting. Today's press brief The questions are going to be limited to the Minister of Health so that you can ask all the questions for the benefit of the public as far as the involvement of the coronavirus pandemic is concerned. And we'll go right away straight into the questions for the Minister of Health, Honorable Chilufi. Any questions? Yes, please.
Good morning, Minister. My name is my first question, I want to find out to clarify when this third case was determined, the day in particular. And then secondly, I understand that the Minister of Foreign Affairs is traveling or has traveled to the region. Do you think that he can do it? What is being put in place?
Thank you.
The third case was diagnosed yesterday, and the laboratory results were released yesterday, and the patient is in our custody and is receiving treatment and is responding well to therapy. We have discouraged non-essential travel. Non-essential travel means that we are able to accommodate essential travel. So the Minister of Health, the Minister of Foreign Affairs, if he does travel on essential travel, we put in measures that ensure that he is safe from contracting the epidemic. Should he come into contact with cases, we are able to put in measures, including the quarantine. But like I said, non-essential travel is what is discouraged. It does not state that we ban travel. So we'll be able to assess and use political, technical lenses and ensure that we do not ground to a halt. And so the Minister of Foreign Affairs is safe. This morning I was called by the Minister of Home Affairs. He had come from a COVID high-risk country. Well, I almost put him under quarantine, and but we engaged, and quickly we realized it was essential travel. So he's with us here today, and believe you me, he did not come into contact with anyone with COVID. So he's a very safe participant in this public gathering.
Thank you so much. Yes, my lady over there.
I want to find out if the ministry has any plans on distributing free face masks and also hand sanitizers to the street kids. And knowing that if at all one contracted the virus, it would be very easy to spread it amongst themselves and the general public. Aside from that, what measures have you as a ministry put in place to educate the street kids, knowing fully well that most of them hardly watch TV or listen to radio stations? Thank you.
Well, thank you very much. The use of personal protective equipment or wear is restricted to circumstances and to individuals at high risk, and also situations where you are confronting cases, that you need to, treat in the perspective of health workers. So we have no plans to distribute face masks to street kids. However, working in a multi-sectoral approach, working with our colleagues in the Ministry of Community Development, we shall ensure that no one is left behind. And every member of this country, every citizen of this country that requires social protection, including protection from ill health, shall be catered for. And we shall engage to ensure that we put in measures to protect everyone, including street kids. Hand sanitizer and hand sanitizers. Sorry for sounding like sanitizers, sanitizers. But it's hand sanitizers. Yeah, these are just the option that you use when you don't have running water. The first thing that you do is to wash your hands using soap, with soap. Wash your hands with water and soap. If you don't have water and soap, then you can use hand sanitizers. It's convenient, but we're not saying that you can only clean your hands when you have sanitizers. No, you use water, and that's the primary thing. Water with soap. And if you don't have water with soap, yes, use your hand sanitizer.
Next question? Yes, over there.
Thank you. My name is Kavinda Kalimina. I want to find out. Thank you.
I just want to find out what you feel is going to make you in order to actually ban traveling, because with cases you mentioned, it's of people who've been coming away from Zambia. So it's those who got the virus away from Zambia. So after how many cases do you think is going to be in order to ban traveling? Thank you.
Okay.
Remember, I said we are implementing a scalable response plan. And this means that the measures that we are executing or implementing today measure to the circumstances of today. As we escalate our response, we will be able to announce other measures, and they'll be announced at the appropriate level of political seniority. So the scalable plan we're executing today is only dealing with measures commensurate to the state of the epidemic today. And Zambia is ready to escalate this response to the highest level and to involve the highest political authorities to ensure that we protect Zambians from from the pandemic. I want to assure you that the President of the Republic of Zambia is monitoring the situation closely and is managing the scalable response plan through his cabinet.
You take the question here.
Good afternoon, Minister. I'm Joseph Tamet Banda from HTV. I just wanted to find out, BBC had reported that a Chinese billionaire had actually donated testing kits and protective clothing to African countries, which are so far in Ethiopia. Has Zambia benefited from that consignment?
China has been a strategic partner of Zambia in our public health security system. Like I said earlier on, our public health security infrastructure, our public health security system has not been brought into effect just with the COVID-19 outbreak. It is something we've been working on and something that we've been building as part of President Lungu's transformational agenda in the health sector. And it has been the public health operating or command center, even for the cholera outbreak, and for many other silent public health threats that we've dealt with silently. So the Chinese have been working with us. The US government has been working with us, setting up the system. We have other partners like the EU, the UN family, DFID, Public Health Institute of England, the Japanese, the World Bank, and we've been working with all partners, and we place on record our gratitude for them. So the Chinese authorities have worked with us in this time of crisis and before to ensure that we respond appropriately to this outbreak. What have they given us? We've received support in terms of capacity building. We've received support in terms of test kits, and we continue to engage to ensure that we can receive support in the various other areas. But I must state categorically here that the American government, the EU, the World Bank, the UN family, the British government through DFID, Japanese government, are all strategic allies, including the World Bank, supporting health system strengthening, including public health security.
Do we have, I think the follow-up of the question was, do we have any of the masks or other
Yes, which
stranded?
Haribaba had donated to Africa, and they are currently in Ethiopia for distribution. Has Zambia received its consignment?
Well, Zambia is working with its global health partners to ensure that all the support that is due to Zambia is gotten. As we speak today, we don't have anything stuck in transit, and we're working with everyone to ensure that what should come to Zambia on time comes to Zambia. So we don't have anything stuck in transit.
Okay, take your question.
Minister, how can you estimate the level of compliance? In the case reported of non-compliance,
I repeat again. Minister, how can you estimate the level of compliance? In the case reported of non-compliance, or where could you report that kind of case if you find that and not comply, not to go They are not being put in place.
Well,
This year, this night, I found a waiting across the road. The waiting going on. Across the road.
You found what?
A waiting going on across the road. This night.
Oh, wedding.
Thank you for that question. All the measures that are being implemented are backed at law. The statutory instrument 21 and 22 that have come into effect, and what the authorized officers are doing in the field is backed at law. And so we will ensure enforcement of the measures that are in the statutory instruments to protect the public, from the hazard of COVID-19. So compliance is a must. Do we have cases of non-compliance? Yes, and those have been followed up very aggressively. We're working with our colleagues in Home Affairs, our colleagues in local government to ensure compliance. You see, I am speaking here and saying, let us be compliant and cooperative. I'm sure if I give the microphone to my colleague from Ministry of Home Affairs, he'll just say, we'll arrest you. He is right. If you break the law in public health and you breach the rules of quarantine, you are breaking the law and you are actually supposed to be his client. And so we are stating here that we do not believe in punitive measures. We believe in empowering empowering ourselves with information so that we can all work together to protect ourselves, to protect the own good public health, the health of our people. So we do not want to be punitive, but want to emphasize that whatever is being executed by our authorized officers in the field is supported by the law.
The lady there.
Good afternoon, Minister.
Can you speak up?
My name is Flavia from Rainier Brain. My question is, I have two questions. The first one is that, do we have sufficient ventilators? Okay, can they be used as a mode of treatment? The second one is, I watched a news item last night, which was reporting about a Chinese national that have quarantined themselves in their house. Do we allow such kind of quarantine, or has this information reached your office?
Two issues. Let's explain self-quarantine and needs.
Thank you so much for those questions. If you come from a COVID-19 high-risk jurisdiction, or you have transited through such a jurisdiction, or you've come into contact with an individual with COVID-19, and you arrive at any port of entry in Zambia, and you do not have any symptoms, you are asymptomatic, you are not showing any evidence, you don't have any complaints of the flu, a fever, or temperature, or headache, body pains, we will impose a 14-day quarantine. It is mandatory, and it is a self-quarantine. We will quarantine you in your safe space. You are expected to be in your safe space. Could be in your hotel room, could be in your room in your home, in your safe space, and you do not interact with the rest of the public for 14 days to ensure that we take stock of the 2 to 14-day incubation period. An incubation period is a period from the time when you inhale the droplet with that virus to the time when you start exhibiting the signs of the disease, symptoms of the disease. So it takes 2 to 14 days for you to start showing that you are infected. So when that 14-day period passes and you do not have any of these disease signs or symptoms, then we free you. So far, we have reintegrated 460 travelers out of the 2,900 plus that we have been following up. The rest are still under our close follow-up to show you how sensitive we are, or the system is, the cases that you have in our facilities today that are receiving treatment have been cases that have passed through our port of entry without any signs of disease or symptoms of disease, but because of our follow-up, we've been able to pick them up and admit them. The other one, and including the other 4 that we're actually closely following up, we received calls from the public. We have a neighbor who is unwell and he hasn't been to those, and he flew into the country. We want to thank members of the community for being that vigilant. We want to thank that pharmacist who called us and told us he had a patient who came to look for medicine for flu and he's suspicious, and we made a follow-up. That surveillance that is dependent on community participation, on rumors, on suspicion, is what will protect all of us. And so I want to state here that the community has been very supportive. Travelers have been supportive, and for the few that have breached quarantine rules, we are sending a stern warning that the law will visit them. And we are saying here, it is in the common interest of all of us to observe self-quarantine. In other jurisdictions, the quarantine is restricted to specific hotels at your own cost, and we've seen this online. But we are saying we are going to quarantine you for 14 days in your own safe spaces, and we'll follow you up. Please let us work together. Ventilators. Remember that COVID-19 is a viral infection, virulent. It may be a mild disease with just mild symptoms, just running nose, fever, or temperature, headache, and within a few days, abates, and you're okay, and you're good to go. But you may also progress and get very severe disease where the lungs begin to fail, or the respiratory system begin to fail, the cardiopulmonary system begin to fail. You need to be supported on a life support machinery. The ventilators are placed in our facilities where we're managing these cases, so that should we progress to the level where you need life support, you need ventilation, we are going to do that. So we have our isolation facilities or treatment centers adequately equipped with ventilators, human capital, and other materials that we require to treat.
Next question. Yes, my lady behind there. If you can just speak up so we could hear you.
Good morning, Honorable Ministers. My name is Nancy from Zambia. I just wanted to find out how much the government has received in terms of support from cooperative partners, both in material or financial support.
Thank you.
Well, thank you very much. His Excellency President Kachagwamu summoned an emergency cabinet meeting and in a proactive way set up a contingency emergency fund for us to respond to the COVID-19 threat. And 7 million kwacha was set aside. Partners have come on board. I mentioned them earlier on. The UN family, the American government, the Chinese government, the Japanese, the EU, the World Bank, the British government through DFID, the Public Health Institute of England. Many other cooperating partners have come on board to support the response. We have seen corporates come on board to come and support this response. We've seen a corporate institution in Zambia called Lamasat that has dedicated a dry port for us to allow buses that are coming from outside the country to disembark passengers from there, where we have dedicated surveillance staff who are able to screen those passengers. We have other local companies, Zenith, that have supported the response. We've had many companies declare intention to do that, and we encourage many more to do that. And it's probably at this point that we would ask the NAPSA Director General to quickly come and tell us what they want to do to support the response.
The Honorable Minister of Health. May I also recognize the presence of other cabinet ministers, Honorable Minister of Information and Broadcasting, Honorable Minister of Home Affairs, and the Honorable Minister of Religious Affairs, and the cooperating partners with us here. Honorable Minister from the National Pension Scheme Authority, and on behalf of the Board of Trustees of NAPSA, we first and foremost would like to appreciate the government through your ministry, the work that you are doing concerning this pandemic that now affects all of us. We are appreciative of the information, Honorable Minister, that is coming to the public. We would like to give you that feedback, that it is really helping us as citizens of the country to know exactly what is happening and the measures that government has put in place, which we need to respond to as citizens, to first and foremost protect ourselves and protect each other as a community. And therefore, we didn't want to just enjoy what you are doing, Honorable Minister. We've taken it upon ourselves that we should respond to assist, even as we implement these measures. To this effect, we are making a cash contribution from our corporate social responsibility activities of 1 million kwacha. This Honorable Minister is intended to assist, as you have indicated, to procure various supplies that are required in our various centers that are ensuring that this disease is taken control of. We trust from the authority that this will go in some way to help the efforts that government is doing. I would like to thank you for this opportunity for us to be able to be part of this process and efforts that government is making. Thank you very much.
Thank you very, very much. You're very good.
We need to sign. Okay.
We don't reach using hands now, we keep.
Okay, members of the press, shall we have 2 more questions for the minister before we wind up? We'll take a question from there very quickly.
My name is Darius from Diamond City. Honorable Minister, we have observed that bars and nightclubs have continued operating. We have not seen a reduction in terms of hours as is SI stated. We just want to find out, have you put up a task force of people that are monitoring them? Because we have seen in other countries like Italy that the cases have continued going up because people are not adhering to the restrictive measures. So we'd like to find out from you. And another question also, of the 2 cases that we received, we want to find out how are the 2 people faring? Are they showing any signs of recovering, and also where they're receiving the treatment?
Well, thank you very much for those two questions. Like I alluded to earlier on, all the activities that are being implemented, all the interventions that are being implemented by our authorized officers, by the public, have the backing of the law through statutory instruments number 21 and 22. There will be officers that will be going around to ensure compliance. These officers come from the multi-sectoral team. It's a multi-sectoral response. So you see police, you see security officers, you see health inspectors, you see medical officers. Should you fail to comply to the provisions of the statutory instruments, you would be breaching the law and you'll be putting the public at risk, and we will quarantine you by some minimum force.
And the other two patients, the first two cases, how are they doing?
I reiterate my earlier statement. I reiterate what I said earlier on, that the two patients that we admitted first, that tested positive to COVID-19, are responding well to treatment. Our diligent workers in our isolation facilities have been able to manage them very well, and they're responding well to treatment. As we speak, tests are being undertaken to assess with evidence the level of recovery. But in terms of symptoms, they are carrying no symptoms and are recuperating very well in their isolation facility.
We'll take the last question for this afternoon. Is there any other question? No? Maybe, Minister, you can just reiterate for the public once again what we need to look out for to keep safe as far as this pandemic continues to evolve.
Countrymen and women, the disruption, potential disruption in our livelihoods, in our economy that will come with an overt COVID-19 outbreak would be potentially catastrophic. We would want to emphasize the need for us to prevent this outbreak, working together as community members, working together in a multi-sectoral approach with the community being key stakeholders, with our cooperating partners, with the government of His Excellency President Kachabolu, in a multi-sectoral one government approach, we can protect ourselves from COVID-19. Basic principles: wash your hands, clean your environment, avoid non-essential travel, make sure you report any suspects, make sure you are responsible enough, should you be found in a situation where you require to be in quarantine, to observe the rules of quarantine. Make sure you engage us through our toll-free lines should you be unwell. For those who default on that, let the neighbors, let the next person support that. Make sure we work together to ensure the country is protected from COVID-19. So far, we have not recorded evidence or cases of human-to-human transmission. We have imported cases, and we must just ensure we keep our guard high. I want to conclude by emphasizing that the government of His Excellency President Kachabolu, in transforming the health sector in a multi-sectoral manner, will ensure that public health security is pitched high. Let us all work together to ensure that we are epidemic secure.
There you have it, ladies and gentlemen, our latest update today from the Minister of Health. He has emphasized that it is very important for all of us to work together. We want to thank once again as a government, our cooperative partners. We want to thank all the members of the community who've been so alert in reporting some of the cases. I think the Minister here will emphasize if you have a flu, a cold, stay home and seek medical advice so that you can save other people around you and in the community. And lastly, we wish to thank you once again, the media, who have really played a very important role since we began this process of updates to the nation. We can only succeed at this if we continue working together, and you, the media, are really at the center of this process. So thank you very much, and enjoy the rest of the Sunday afternoon. Thank you.